Hi, I'm Dr. Hillary from Rangeline Chiropractic. I'm hopping on live today to do a fun Q&A with my spinning wheel. This is my favorite thing to go live on Facebook and do and answer your questions that you have. So feel free to post a question below and I'll read your question, answer it, and then you could win one of the gift cards. So I have some that have already been submitted. We'll start with those, but I would love to answer any live questions you have. So feel free to post a comment below. Sometimes it doesn't say the person's name. You might need to put your name, but that's only if you want to win a prize. So I have some people have submitted things without names, and that's fine because I'd still love to answer your questions. But I'm going to start with one that Stacy asked me earlier online. She wants to know about a posture corrector and if I would recommend it. So if you haven't seen a posture corrector, it's kind of like an X on your back, and it goes under the armpits and it kind of crosses in the upper back. And the goal is to keep your back straight in your upper back. So you know how like when we're on our computers too long, we're like hunching forward and we've got that little like hump in the back and our shoulders are rounded forward. A posture corrector fixes that. We have some for sale. There are some good ones on Amazon. In fact, on our website, rangelinechiropractic.com, I have a link to my favorite one on Amazon, so you can go and click on that link and see it. The other thing I don't love about posture correctors are that it kind of like rubs in your armpit area. I suggest putting it over a t-shirt and then maybe your shirt over that, because they're definitely not cute at all. So Stacy, thanks for asking that question. Yes, I do recommend them. The thing is, with any type of brace or corrector, you just can't live in it forever. So it doesn't take the place of like good adjustments and alignments and strengthening your back. So let's spin the wheel, Stacy, and see what you've won. As always, you guys don't need to be present to win. I will just reach out to you on Facebook and just kind of let you know what you won. So Stacy, we're spinning the wheel and you want an Amazon gift card. So I will write that down, and that's easy because I can just send that to you. All right, let's ask another question. And again, anyone watching, feel free to comment a question below. Okay, dry needling. Good, because I get this question a lot. Like, what is it? Why is it different from acupuncture? And what's it used for? So dry needling uses needles similar to acupuncture to reduce muscle tightness. So for instance, I have a lot of patients that are super tight in their upper back and they have these knots up in here. Dry needling is great. It goes into the trigger point of the muscle and then it stays in for a few minutes. And the point is like the muscle just like kind of relaxes after the needle is pulled out. It's very effective, especially for those stubborn spots. So we do it a lot in the upper back and then, like the middle back by the shoulder blade area. That's also a favorite because sometimes you can stretch and you just cannot get it. The third favorite spot for patients is in the glute muscles, because I have a lot of people that are super tight in there, especially with sciatica and the piriformis muscle. So dry needling is great for those things. It doesn't hurt. It feels like a little pinch or a prick, but it's not as bad as like when you prick your finger with a safety pin. Like I find that way worse than dry needling. And it is very effective in a less amount of time than if you were to get like a deep tissue massage in the area. So patients that have not enough time and they're super tight and stressed, like, well, everyone right now, dry needling is a great option. I just had someone hop on and say, what would you suggest for a lumbar support? Great question. Similar to the upper back brace supports, lumbar supports are great when you need them, but not all time. There is also a link for a lumbar support on our website, rangelinechiropractic.com. It's an Amazon link that I like to support. It's called a dual pulley system. It's like one that wraps around, and then it has another side ones that you take and you like unvelcro side by side and you pull it even tighter. Also, tip for lumbar supports, they're much easier to put when you're laying on your back in your bed. They're hard to get on. It's a lot of Velcro and a lot of stretching and pulling. So I tell patients sometimes it's easier just to like lay on your back on your bed, put the pulley on, and then roll to get up again. So it's called a dual pull. And again, it is on our website. Thank you, Facebook user. It doesn't tell me the name, but thank you for asking that. I'm going to spin the wheel, and if you want to message me later with your name, I'd be happy to send you a gift card. So let's see what we have here. And yes, I love this spinning wheel, in case anyone wanted to know. I enjoy doing it. We have got a gift card from Ella Bardot, and so she is local in Carmel. So if it says Facebook user on my end that wanted to know about the lumbar support wants to reach out to me, I'd be happy to get this to you. Must be Christina. Okay, I've got one for you. Thank you so much for asking. And we've got a comment that someone loves dry needling. I know, me too. I probably needle like on my busy days, like over a dozen patients a day. And so, I mean, I go through like 100 needles a day. It's fun. Some people only need like 4 needles. And then some people are just like really tight everywhere, and they have several locations, and I might be doing the whole back. And then we joke like it's like a porcupine because there's so many needles sticking out. It works so well. I've been doing it for years, and I was just telling someone yesterday that I was one of the first ones in the class in Indiana for certification for dry needling for chiropractors, and I was the only female. So I've been doing it for years. I love it. I feel like I'm really good at it now, and I get some great results. So dry needling, definitely everyone needs to try it. Okay, I have time for one more question in my little question bowl. Of course, if anyone else wants to pop on and ask a question, happy to. This person is anonymous, but wants to know about a chiropractic in pregnancy and if it's safe and what it can help with. So yes, chiropractic care during pregnancy is definitely safe. We have these special like pillows that you lay in, and it holds your belly so you're not laying on your belly, because a lot of patients go, I can't lay down. Yes, I'm very well aware of it. We can do the manual adjustments where I like push on you and the table pops up and it drops down. And then some of my pregnant patients prefer me to use like a tool called an activator. It's a little bit more gentle because they don't want to be pushed on, or maybe they're just too tight and uncomfortable. But getting the pelvis and the tailbone lined up are like super key during pregnancy. I also can work on like tight ligaments in the front, like the round ligament, and then the pubic bone in front. Can give you a lot of sharp pain when you get up and move. So anyone that's been pregnant will kind of be like, oh yeah, I remember that. I work on that, and like the muscles that are really tight that are pulling on the ribs when the belly grows, I can help with those muscles. So there's a technique called Webster Technique that I am certified to do for pregnant women. And I think right now we have like at least a dozen. In fact, any day now, I have a patient I saw yesterday. She's literally due any day, and I hope she's due today. I told her yesterday when she was in, I said, I hope I don't see you next week, only because I want to see this baby girl of hers. So we love pregnant women. We have a lot of different ways we could do it to make everything comfortable. And then, of course, obviously, we don't take any x-rays for our pregnant women. So we have a lot of pregnant women lately, and makes you wonder with all the COVID extra time, huh? A lot of kids today. In fact, there's a lot of kids running around right before I got on. So we do see kids and babies and pregnant women, and chiropractic care is very safe and gentle and effective for nearly everyone. I can barely think of anyone that it wouldn't be helpful for. So always feel free to reach out, ask questions. I love my spinning wheel, so I'm going to need some more questions next time. I'll post on here, ask me questions. I love it. Even if it's after this time you're watching like a live replay, feel free to ask questions, and I'll just put it in my bowl for next time. So I'm going to do it again. Thanks everyone for watching, and Christina, thank you for commenting.